This video is for medical students working in Watson Lake Hospital, Dawson City Hospital, or Whitehorse General Hospital. It will go over the basic functions of Meditech. When you log into your desktop, you will be able to find the Expanse Live icon. It will either have the Microsoft Edge image above it or a Google Chrome image. If you cannot find the Expanse Live application, you will for sure have a YHC links folder. When you click into the YHC links folder and scroll down to the M section, you will be able to find Meditech Expanse Live for physicians. Also in this folder, you will be able to find the link to our tip sheets located under One Health Physician. When you click into the Meditech Expanse icon, it will pull you to a screen that has your credentials already in it. You can click Launch New Session, and then it will pull you into a system that looks like this. On the top left, you will see a Return To button. This is how you can access previously opened pages. Next to this is the Home button. The little drop-down arrow is how you can navigate between the Emerge tracker and the Acute Inpatient tracker. You can click onto the arrow and select the tracker that you would like to view. The 4 tabs at the top are used to navigate within a patient's chart. On the right side, you have access to the sign queue. This will populate when you have pending documents. To view a pending document, you can click into the name of the patient and it will pull up that document. From here, you can continue editing this document by clicking the Edit Document button. At the end of the day, your sign list should be empty of all pending reports. The next tab over is a Workload tab. As a student, you will not be using this tab. Then you have your Menu tab. The main reason that you will be using the Menu tab is to set up your PIN. All of our providers have a 4-digit PIN. When you click onto the Menu button, near the bottom of the screen, you will see an option that says Change PIN. You can click into here to create your own. The other tab that you may use is this Help button. This is how you can submit an incident report. When you click on to Help, you will select Report an Issue. Then you can select Incident. Never select Software Issue. If you're having issues with Meditech or the computer, please call the phone numbers at the nursing stations for our support team. Also at the top here is this Find Patient search bar. If you are searching for a patient by name, you can type in last name, comma, first name. When you click on a patient's name, it will take you into this account list. The admitted account is always auto-selected, but if you would like to view an outpatient account or a discharged account, you will have to click into the correct one on the left sidebar. You will be able to see if the account is active by looking under Type. Then you will also be able to see the date of the account so you know you're selecting the correct one. On the right side of your screen, you have a recently accessed list. This will populate with patients' names as you access their charts. And then if you need to return to these patients' charts, you can click onto the applicable name. The Workload tab is also located on the right side of your screen, but like I said, as a student, you will not be using this frequently. First, we will go over the inpatient side of the system. When you are working with a preceptor and you want to see the patients that they are looking after, you will click on this human icon and you will select Edit Coverage. The easiest way to find your preceptor's patients are to search by provider. In this search bar, you can type in last name, comma, first name, and select the correct physician's name. They will be highlighted green. Then you can hit Save, and it will bring up all of the patients that your preceptor is looking after. As a student, you cannot sign up for patients. This is the only way you are going to be able to see who your preceptor is taking care of on the inpatient side. If you would like to print this rounds list, you can click onto the hamburger button on the top left and click on Report. All facilities will be highlighted and you will select YHC Physicians Rounds List. Then you can hit Print. This will print off a paper copy of the patient's names that you can take around with you when you are going to see the patients. Another way to locate patients is by location. click on Edit Coverage. If anything is grayed out on this screen, you can click Clear. Then you can search the location of the area that you are working. For example, if you are working in Watson Lake, you can click on the Watson Lake Community Hospital and select the Watson Lake inpatients. This will then bring up a list of all of the patients currently admitted in Watson Lake Hospital. Next, we will go over what all of the different information is on the main tracker. If a patient's name is highlighted in yellow, it means there is a patient in the hospital with the same or similar name. If a patient's name is highlighted in purple, it means the patient has a history of reactive behavior. Underneath the name, you will see their age and their gender. Then you will see the unit that they are located on. If you see this ALC bubble, this means that the patient is an alternate level of care, which means they could be waiting to go to long-term care. Then you will see their length of stay. The physician's name in bold font is the attending physician. The smaller name underneath is the family physician if the patient has one. In bold, you will be able to see the patient's special indicators. You can click into this area of the chart to expand the special indicator screen. If there's an indicator with an arrow next to it, you can expand this indicator and you will be able to see comments associated with it. You are able to add comments, and you are also able to add new indicators by clicking into the search bar and selecting one from the drop-down menu. Special indicators stay with patients from visit to visit, so they will be on the account until somebody manually removes them. Next to this, you will see the patient's resus status if it's ordered. And then you may see this REQ button. This stands for our best possible medication history. Pharmacy techs complete our best possible medication history. They are here between 7 a.m. to 7 p.m. If the patient is admitted overnight, the admitting provider orders whatever medications the patient needs to get through the night and first thing in the morning, and then at 7 a.m. the pharmacy tech will complete the BPMH. Whoever is looking after the patient at that point is now responsible for reconciling the home medications. Once the BPMH has been completed, the REQ button will change to say CMP. You may also see this FN button. This stands for First Nations. All of our patients get asked if they want to identify as First Nations, Inuit, or Métis. To refer a patient to the First Nations Health Program, you can enter a referral under the Orders section of the chart, just like you would a social work referral. In bold at the top here, you will see the patient's room number. Underneath the room number, you can see a list of their active problems. If there is this ... you can click onto it and it will show you the expanded version. Then you will see this yellow sticky box. This sticky box is just for you and it is not part of the legal record. You can write notes to yourself in here and nobody else will be able to see them. And then when the patient is discharged, this note will disappear. On the very right, you have this gray box with different headers in it. This is how you will be notified when there are new results on a patient. The result header will change color. When you click into the gray tab, it will pull up those new results and you will be able to see a quick link view of what the blood work is or if there's any new notes or medical imaging reports. To review a note, you'll just click into the title of it and it pulls you into the note. To view the Emerge tracker, you will click on the drop-down arrow next to the Home button and click ED Tracker Homepage. On this tracker, there are a few different tabs you can choose from. My List, All Patients in Department, and To Be Seen. All Patients in Department will show you all of the patients located in rooms as well as in the waiting room. And then the To Be Seen tracker will show you patients who are triaged and waiting to be signed up for by a provider. And then the MD to Reassess column will show you patients that are ready for reassessment. As a student, you cannot sign up for patients in the emergency department, so you will just have to navigate through the All Patients in Department tracker to find the patients that you are looking for. On the Emerge tracker, it's very similar to the inpatient side. The main differences are that you can see the patient's triage score and the status of the visit. This status auto-updates for some things, and others nursing will manually change. For example, when a patient's triaged, it will automatically say triaged. When a physician signs up for a patient, it will automatically say with MD. Then nursing can use this status bar to change the status to in progress while they're working on the orders. They can also change this to MD to reassess when the patient is ready for reassessment. Then you will see this no document sign. This means that no emerged document has been started on this patient. When a document has been started, it will say draft or pending, and when it's completed, it will say signed. Underneath is the pink triage box. When you click into this, it will show you a brief history of the patient's triage. Gray box here, you will be able to see who the physician is that has signed up for this patient. Underneath it, you will see the nurse's name that is looking after this patient. The other main difference is that the yellow sticky box on the right side is not just for you. This is used as a communication tool between nursing and physicians, so anything you write in here, others will be able to see. There's also this order button. This is a quick link tab into the order section of the patient's chart. And similar to the inpatient tracker, as new results populate, these boxes will turn green to indicate that there are new results. You can click into this box to view those results. To access a patient's chart, you can either highlight the patient in green and use one of the 4 tabs at the top, or you can click on the patient's name. Once you are in a patient's chart, it does not matter what area of the hospital you are working in. The inside of patients' charts all look the same. When you click on a patient's name, it will pull you into the chart. On the right side of the screen, you will see the patient's name and some information about them. Underneath that are the quick link tabs. You can see the patient's allergies, their problems, and quick links to vital signs, home medications, and order snapshot. When viewing allergies, if you click on the title of the allergy, it will pull you into the allergy edit screen. From here, you can remove allergies as well as add new ones to the chart. To add a new allergy, you can click into the search bar and type the name of the allergy in and pick it from the drop-down menu. The problems list. When you click onto the problems header, it will pull you into the problems and histories list. If you would like to add a new active problem, you can search for it in the search bar by typing in a few characters. It will pull up a list of all of the coded options that you can add. You can decide if you're going to make this an active problem, history, or both. Once you make your selection, it will populate to that applicable area. Click on the drop-down arrow next to the name of the problem. From here, you can add comments associated with this problem. You can also add it to the patient's medical history if desired. If you added this problem in error, you can click on the big gray X to remove it. You can also click on the status bar where it says acute, and you can change this to chronic, suspected, resolved, ruled out. You can also delete the item from here. If you would like to reactivate an old problem, you can find it in the medical histories list. From here, you can click on the problem you would like to reactivate and select the reactivate button. It will then pull it over to the active problem side. If you would like to add a problem to medical history, that is when you can hit add to history at the top. If the problem is no longer active, you can also select move to history and it will move the problem to the history section. Once you're happy with your changes, you can hit save and they will be updated on the problems list. On the main chart, you will see this flow sheets tab. This is where a bunch of information from the chart gets pulled into one section. You'll see vital signs, intake and output, lab tests, provider notes, nursing notes. The more that is documented on the patient, the more information will show up here. These categories are divided into 12-hour periods based off of our nursing shifts, which are 8 to 8. The next tab over is activity. This will show you a chronological order of everything that has happened to the patient since their arrival. The main reason for viewing the activity tab is to see previous visits. If you click on activity log and change this to visits, it will show you all of the patient's previous visits to Watson Lake, Dawson City, and Whitehorse General Hospital since 2021. You can then click on the drop-down arrow next to the visit you want to view and see the associated physician reports. The next tab over is summary tab. This also pulls different information from the patient's chart. The main reason why you'll use the summary tab is to find scanned in documents. When blood work comes back from BC, it may say see lab scan document. This is where you will find those lab scan documents. The other tab is the general scan documents tab. This will pull information from the patient's chart that has been scanned in since 2021. This is where you can find consent forms, care plans, mental health act forms. The next tab is workload items. This is where you can see CC documents, consult requests, and something called HAYDOCs. HAYDOCs are non-urgent messages sent to the physician by nursing and allied health. You can click onto the title of one of these documents and see the message that nursing sent, as well as the physician's reply. The Other Clinical tab has a bunch of different headers. The main headers we will be using are the first 4. This is where you can come to view the special indicators, allergies and adverse reactions, blood product summary, and the patient's care team. For special indicators, you can click on the drop-down arrow next to the name of the indicator and read the comment associated with it. You can also edit indicators from this screen by clicking the Edit button. As well as allergies, it is the same as viewing allergies from the right side of your screen. If you would like to edit, you can click on the Edit button here. The blood product summary is the only place in the chart that you will be able to see what blood products the patient has been ordered or is currently having transfused. Click on the drop-down arrow next to the header that you would like to view. And for Care Team, this is where you can see who their family provider is, who admitted the patient, and who their attending is. The next tab over is Administrative. This is where you'll see the patient's demographics. If you scroll down, you can also find the patient's contacts and insurance information. The next tab over is History and Problems. This is the same as viewing history and problems from the right side of the screen. When you click on the drop-down arrow next to the category you want to view, it will bring up a list of their problems. If you would like to edit these, you can select the Edit button and it will pull you back into that Problems and Histories list. Medications. This will show you the active medications on the patient's chart. If you would like to see what nursing sees, you can click on where it says Current Visit and you can change this to MAR. This will then pull you into the nurse's medication administration record, where you will be able to view when medication was last administered, if it's late, or if it's discontinued. If you click on Current Visit, you can also view their home medications. These home medications are only up to date if pharmacy has confirmed them for this visit. Otherwise, these medications are pulling from the patient's last visit, so could be up to 4 years old. Make sure you're clicking on the drop-down arrow next to the name of the medication to see when it was last confirmed. The Nurse and Allied Health tab is where you can view nursing and allied health documentation. Click on the drop-down arrow next to the category that you would like to view, and then you can click into the title of the assessments to view the flow sheets. If there is a note associated, you can click into the note icon and it will open up that note. Provider notes is where you can see all previous provider notes. To view a note, you can click into the note icon and it will pull you into that report. You can also select the filter button to filter these notes by time frame and subcategory if you are looking for something specific. Diagnostics. This is where you'll be able to see all of the patient's diagnostic information. For lab work, if a lab is highlighted in yellow, it is considered abnormal. If a lab is highlighted in red, it is a critical lab. For critical labs, lab will call the nursing station and nursing will call the physician. There is only one main lab in the Yukon Territory, so any blood work that the patient has had in territory will show up on this screen. To click back to previous visits, you can use this gray arrow in the top left. The imaging header will show you radiology reports. You cannot actually view radiology images through Meditech. If you would like to view radiology images themselves, you will have to ask your preceptor to open up Synapse on their desktop. Then you'll also be able to see microbiology, patho, blood bank tests, and cardiovascular. Cardiovascular is where our ECGs are scanned in. If you are working in Emerge, the nurses will provide you with a paper copy of the ECG prior to it being scanned into the chart. To view the scanned ECG, you can click on the camera icon and it will open up that image. So this is how you can view all of the information in the patient's chart. To document on a patient, you will select the Document tab at the top. This will open into our document template options. If you do not see any options favorited for you, you can click Show All and it will pull up every single template that you can choose from. If there's templates that you want to add to your favorites list, you can click on the star and then deselect Show All. That template will now be added to your favorites. You can also search for document templates by typing the name in the search bar. Once you find the template that you would like to use, you'll click onto the title of it and it will pull you into our document. Documents are sorted by different headers, so you can scroll down and find the header that you would like to document under. In narrative areas, when you click into the area, you can start typing. If you would like to pull formatted data into a document, you can click on the A with the drop-down arrow and select Formatted Data. This will pull you into the search bar. The easiest way to search for templates to pull is to type the fewest amount of characters possible into the search bar. This will bring up a list of all of the different options. If there is something that you will be pulling frequently, you can star it and it will be added to your favorites bar. Once you have favorited documents, it will look like my screen where you have the blue boxes. Then you can click into the information that you would like to pull into your documentation, and it will pull. In some templates, there's preset information that pulls into the document. If you're viewing this information and something is incorrect, you can click in this general area and it will pull you into the problems and histories list, and you can make edits to this right from your document. Also in documentation, when you come to areas like this exam section, you can click Rapid at the top. This will enable you to go through your exam and click off everything you would like to document under each heading. If you would like to add a comment, you can click on the comment box and add a free text comment. You can also click on images and draw on the images. Then you can see that this information has now been pulled into your documentation. Another thing that you can do in documents is add content. For example, under the exam section, I would like to add a chest pain assessment to document on. Click on Add Content and click in the search bar. It will bring up a bunch of different templates that you can choose from. I'm going to type in chest pain and hit Apply. This will pull that chest pain assessment into my documentation. Then I can hit Rapid Entry and go through and click off what I would like to document. Same as before, if I want to add a comment, I'll click on the free text area and write my free text comment. Certain things in documentation is mandatory, and those will have asterisks next to them. For example, the admission diagnosis is mandatory, so until you put in an admission diagnosis, it will not let you sign off on this document. If you are in a document and you realize it's the wrong template or you're on the wrong patient, you can click on the hamburger button next to admission note and then click Change Document Status to Deleted to remove this document. If you are in the middle of the document and you get pulled away, you can hit the Save button. This will save the document for you in your document bar. Now you can go exit out of the chart, go to other areas of the account, and when you come back to the document bar, that document will be waiting for you. To get back into the document, click on the title of the note and it will pull you right back into where you left off. If you would like to see a preview of what your finalized document will look like, you can click the preview button at the top, and this will show you what the finalized copy will look like. When you are done with your documentation, you can hit the Sign button. This will pull you to our contributor screen. At the top, you can see there's a warning that says a cosigner must be selected. Underneath that, you have your encounter date and time. This is when you saw the patient. So if you haven't had a chance to document for a few hours, you can click into the calendar and you can backtime this to when you actually assessed the patient. Under contributors is where you will pick your cosigner. If you do not see the name of the physician that is your preceptor, you can click on the plus button and search for them by name. Once you find them, make sure to star them and then they will be added to your contributor list for all future documentation. Once you have selected your contributor, that warning will disappear. Underneath Principal, your name will be highlighted since you are the one writing the document. Underneath Document Specialty will show your specialty. And then under Copies To, all of our documents automatically get sent to the patient's family provider. But if you would like to send a copy of this document to anybody else, you can click on the plus button and search for the provider by name. Once you're happy with that, you'll hit Save and you'll enter your PIN. Now your document is going to show up in your document bar as I signed by you. This means that you have signed off on your document and has gone to your preceptor to be officially signed off on. While your document lives in this document bar, you can still edit it if needed. You can click back into the title of the note and select Edit Document on the top right. Once the physician you're working with officially signs off on the document, it is going to disappear from your document bar. That means that this document has now become a part of the legal record. When a document is signed off by your preceptor, you can no longer make edits to what you've already submitted. You can only add an addendum. To add an addendum to documentation, you are going to go back to the Chart tab and go to Provider Notes. Find the document that you signed off on and click into the chart icon. Then on the top right here, you will see the option to add an addendum. If your preceptor has signed off on a document and you realize that the document was submitted on the wrong patient, you will have to contact Health Records to get that document removed. Orders. If you click on the Orders tab and you get a warning pop up like this, it means that a height and weight has not been entered on the patient. That's okay, you can click Continue to Orders and it will let you bypass it. This is your current order screen. On the left here, you're going to see the order name, you're going to see who ordered it, the start and stop date, and the status. And then you have these little blue eyes on the right that you can click on to expand the order information screen. Next to current order is this little drop-down arrow. If you click on this, you can click into historical. This will show you all active and completed and discontinued orders for this patient's visit. To get back to current orders, click on the drop-down arrow and go back to current. If you would like to edit an order that has already been submitted, you can click onto the name of the medication. It is going to pull you into your provider and source screen. This is where you select the physician that you are working with, and you are going to select medical student and hit save. Then you can edit the order by clicking into the green sections. For example, if you would like to change the dose, you can click into here and type in the custom dose. It is going to ask you when you would like to stop the old dose and start the new one. Then you can see that this order has been edited and now you have one order to submit. If you need to stop an order that has already been submitted, under status where it says ordered or active, you will click onto this and you will change it to stop. You will need to put in a reason as to why you are stopping this order. Once you have entered that, now you can see we have two things in our submit bar to sign off on. Once I'm happy with all the edits I've made, I'm going to hit my submit bar. If you get a conflict, it means that there is duplicate therapy ordered on this patient or the patient has an allergy. You can either override this conflict if it is not applicable, or if you would like to erase the order you put in, you will hit the erase button and it will take you back to your summary screen. On the summary screen, you can see exactly what is ordered and what you're changing. It is always good to review your order summary screen to ensure exactly what you're signing off on. Once you're happy with that, enter your PIN, press enter, and submit your orders. To enter a new order, you're going to hit the enter button. Select the physician you're working with and select medical student. Medical students won't need to enter too many orders in this system, but I'll show you how to enter a medication just in case you need to. To enter a medication, you are going to type in the name of the medication that you would like to order. Click on the drop-down arrow next to the medication name. From the drop-down menu, you can select the dose, the frequency, and the route that you would like to order. Injectable and ingestible medications are ordered separately. If I want to order this 10 milligrams of Buscopan, I'm going to click into this checkbox. It is going to turn everything green. From here, I can edit any of the information. I can also click on the gray drop-down arrow underneath the medication name to expand the edit screen. Then I can come in and I can customize my dose, my frequency, and my schedule. To customize frequency, you are just going to free text the frequency that you want. If you want to select set times, you will type in the time with a comma in between them. If you scroll down, you can see there's a spot for label comments, dose instructions, and any other information that you would like to put in with this medication. When you're happy with your order, you're going to hit submit, review your order summary, and enter your PIN. This order is going to say unverified. This means that it has gone to your preceptor to be signed off on. All student orders will show as unverified until your preceptor signs off on them. This means that nursing cannot see your orders until they have been signed off on. As a student, you will not be doing med reconciliation, admissions, or discharges. So the last thing I'm going to show you in the system is this chart viewer tab. When you are in a patient's account, you can click on Chart Viewer to open up two different screens. All of our physician stations have two monitors, so you can have your orders open on one page or your chart open on the other. If you have any questions about Meditech, please refer to the email you received from the Meditech educators with our support numbers